fingers, wrist, thumb, elbow, shoulder. The pattern is not one you're going to need to demonstrate on the test, although it could be something you might want to keep in your head when you do this for a patient. And again, this is from the context of I'm correcting a pattern displacement as opposed to an individual problem. And again, remember that extremity joints are smaller, they don't take as much force, and as long as you, again, support and protect the anatomical boundary, you're not really at any risk of jacking somebody up. Always need to take into consideration if somebody has had a problem, you know, with an injury or their tolerance for movement, because you don't want to be without sensitivity and also first do no harm. But generally speaking, extremity stuff tends to be easier from that context and safer. So to do the fingers, one of two ways. I just hold the finger like this, so grabbing it, and then I'm holding the wrist, and I'm just kind of shaking and pulling. Shaking, pulling. Shaking, pulling, shaking, pulling. That's it. You can consider if somebody has kind of a hand problem, this is not on the board, but you can rotate medial and lateral, so you just mobilize the MCP. This is all mostly just about mobilization. You can consider doing the varus and valgus stress test on the hips. This is what a lot of people sometimes just do themselves to kind of loosen up their hands, right? Okay, so you all got the finger thing. The finger thing's pretty easy. Another thing, I've had sometimes people grab the finger like this, and you can do the same kind of thing, shake and pull, shake and pull. I prefer the whole hand. And this is also not on the board, but this was shown to me as somebody who did energy work. And once you potentially want to close the meridians, you can use the same thing like this and just all the energy, you want to just pinch it off, you can just do that. So I just kind of use my hands like this, a little bit of a shake, it just pulled off. It kind of makes a snap. Doesn't really hurt, right, Lauren?
No.
Yeah, good.
Is it bad to do it backwards and forwards?
I just do it straight.
No, I know, but I've had people ask me.
Oh!
But is it bad to do it up and down?
Do what up and down?
To crack your knuckles. Like
Oh!
this.
It's not bad to crack your knuckles at all.
Oh.
There are studies that show you're not setting yourself up for arthritis. It was just the nuns in parochial school who told you that so you wouldn't make noise in class.
So it doesn't matter which way you crack your knuckle? Okay.
So the pattern of correction that I tend to do for if a person has an upper extremity problem, and I'm going to just follow that pattern of correction. Now that I'm thinking about it, I might forget my sequence. But I tend to check for the lunate. Now I'm just kind of like sprunking stuff around to see what's up, okay? And then I'm going to do scaphoid, triquetrum, lean back just a little bit, anterior lunate, compression distraction, carpal spread, thumb, fingers. I'm going to check the wrist, the elbow now. Which way does it seem, God bless you, to be, tight? It feels a little bit tighter this way, a little bit looser this way, which is pretty common. Before I make my correction for that, I tend to just kind of put a little bit of pressure on the extensor muscle group, make that correction, anterior, or the posterior correction. Then I'm going to do the AC joint. Actually, before I do that, I'm going to do little humeral. So I'm just going to relax. And then put your arm over my shoulder, please. Just relax. That's the AC joint. Then put your palm in your lap. And just doing the scapular. Check it out. Do the trigger points around the scapular area. And then your scapular mobilization this way. Put your hand relax over mine. Doing a particular joint. And then just kind of raise the shoulder up, and then just kind of putting my finger over this way, which is kind of getting the levator scapula. So I'm just doing the other side so you can kind of see it. So just see, I'm just kind of moving stuff around to see what's up, how cookie-cracky is it, lots of cookie-cracky there. And then scaphoid, triquetrum. This is the using my thenar eminence, lean back just a little bit for the anterior lunate. Careful spread and distraction, thumb, fingers. Checking out the elbow. That's the more common one. Just get that muscle relaxed. Boom. Boom. Then a humeral joint. Just relax. Stuck in there. Put your arm over my shoulder. This is the one that's okay. Yeah. AC joint, your lap palm up. Coracoid, humeral, not humeral, but scapular boundaries, just kind of using some of the trigger points in there. And then just scapular stuff. Sternoclavicular joint. Ooh, that feels different. And, just lift up and then. So I'm just kind of like pushing my thumb over the levator scapula. I didn't show that. That's just soft tissue stuff. But that's the sequence that I go through typically if somebody has an upper extremity complaint. So if they have a shoulder problem, I would do this whole thing. Part of it is that we described in the first lecture on exercise. I talked about the nociceptive wave. So what I'm doing is I'm activating all the mechanoreceptors of the joints of the entire upper extremity, down-regulating all of those, wherever the problem is, so that it limits that. That's me. That. So, in relationship to that pattern, that's what's happening. Part of it is to downregulate the mechanoreceptors in a sequence. You're working on all the different patterns to kind of correct that, and then it feels pretty good. Yeah.
And that time.
I know. Well, that's it. And there's going to be when we do lower extremity, I have a comparable pattern correction for the lower extremity as well. So anyway, I just want to kind of show you that so you can see that when you learn the choreography, you can put it together kind of like that. With the rest of the time that we have today, you can maybe revisit some of the supine scapular stuff, the sternoclavicular stuff, the AC joint stuff, and like that. Next week we're going to be doing some stuff with trigger points and neuromuscular technique. And then I think the week after that we're